it is directly related to some of the things we will talk about. But just because health and staying in good health is an individual and a personal matter, we try to replicate that to bring some of it here in the program. So after we talk, and the talk will be very limited because normally our attention span is between 30 to 45 minutes, and we want to use that, right? So the talk will be brief, certainly within an hour, and then we would have the chance to ask questions if we have any. Then we would step in the, I'll call it for now, consultation room. Yes, it's perfect, it's beautiful. The nurses and the other ladies I work with are fantastic. They've done such a great job. You should, when you get the chance, walk and you see what I'm talking about. They are just so beautiful and so very good. Now, today, we want to spend a little time as we're celebrating to reflect on some few things about health. How we stay healthy. How we stay healthy. And it may be a good starting place to look at some basic things in general about health. When we say health, what are we talking about? What is it? I'm sure if each and every one was to pick up any source of information, whether the internet, whether a dictionary, whether a medical book, whether a medical journal, to look at the definition of health, we can have a lot of it. It could be any number of definitions, but today we want to make it very practical, very simple, nothing exoteric, nothing technical, just basic things, and not too overwhelming, something we can take with us. If we took one thing and implemented it, and look forward and stay consistent doing that, then we can impact our health in a positive way. And that is some of the things that we will talk about today. Now, when we pick one, just for discussion's sake, when we look at one of these definitions, or we just use that as a parameter, health can be viewed as, if you will, a complete state of mind which is perfect for the mind, body, and soul. If there is something like complete state of health. But you can also look at it as the absence of a disease. And when you begin to look at it in these directions, then we have to pay attention and put emphasis on where they must be placed. Now, one of the things that I would like to bring to our attention is that health could be visualized as absence of disease, but it's not entirely so. Stated differently, someone may be completely free of disease, but could we all agree that that person is healthy? Can just somebody merely not having any disease be classified as a healthy person? Let's keep that at the back of our mind. Now, if we look at that and we talk about that, then it helps to look at a disease state. What is disease? From the basic definition that we have had, it would be right to look at it as a deviation from health, right? And if we look at the extremes then we have a healthy person, and at this end, a person who we can identify, who we can associate with some form of a disease. Now, does it mean that the people in between could be healthy or could be diseased? If you have a disease, you are out of that subset, right? You can't have a disease and be healthy, can you? Can you not have a disease and be healthy? Let's think about that, and let's keep at the back of our mind. Now, thankfully, my first slide is projected here. And let's project the first slide. It is the center of all what I want to talk about today. And the father of medicine, Hippocrates, stated in a very simple way to suggest that disease state does not spring on us suddenly. Disease state just does not show up suddenly. You don't get up one morning. It may seem so, but you don't get up one morning and just get a diagnosis of diabetes, right? You just don't get up one morning. At least the process just does not show up suddenly. It's a process. It's a process. Disease or diseases are usually a long process. It takes a long time to develop diseases. Now, it brings us to what I'm going to talk about and what I want to stress as my point of discussion this evening. Now, there is such a thing as preventative health. There is such a thing as preventative health embedded in the process of a disease state. Now, it's quite unfortunate. It's quite unfortunate, but it's a fact that our healthcare delivery system today emphasizes on treating diseases and not preventative care. That's a fact. Now, I describe this as being unfortunate. Now, it is unfortunate, and we will get to know why it is unfortunate. Now, when the father of medicine stated that diseases, I wish we could put that slide back on so we can take a critical, yes. Let's take time and read that. Illnesses does not come upon us out of the blue. This is the father of medicine. He said this about 500 BC. It is developed from small daily sins against nature. How does disease develop? Small daily sins against nature. When enough sins have accumulated, illnesses will suddenly appear. This was from 500 years before Christ. It is true today. But it's unfortunate that we haven't paid attention to what the father of medicine is saying. Now, we, as healthcare deliverers and part of a healthcare system, have completely failed when it comes to delivering preventative care. Now, years ago when this was said, and today we will try to stay away from words that are just too technical. In the disease state, in the process of developing a disease, certain basic things would show up. And if we pay attention, or if we really want to be healthy, to be completely healthy, if we want to be completely healthy, and we pay attention, those intermediary processes will lend themselves a wonderful way to prevent diseases and to push diseases away. Now, let's take a little view about the body, the human body. In us are many organs that comes into play. These organs work together in unison. Unfortunately, the medicine we practice these days is so fragmented, right? One patient have 10 physicians. Each physician is focused in the area that he or she specializes, or that is calling for care that they deliver. We deliver care in a very disjoint manner, even though the human body is one entity. That's a problem. It lends itself to so many unfortunate things, some of which we will talk in details in a moment. Now, the human body have each human body has several organs, and some of these organs would clue us in the beginning of a disease state. Now, in each of us, there is one small, tiny cell thickness lining every organ that we have. In fact, if we put that lining together, say we are fearfully made. If we put every piece of that tissue together in each and every one, it will cover the surface area of a tennis court. Wow. In each one of us. Before a disease state would start at a cellular level, this one cell thickness membrane, and this is the only word like that we will use today, called endothelial lining. That is no more. This is the only word we will use here today. This endothelial lining will first be disruptive. It will be destroyed. Now, it takes several years for most of the disease that are killing us today to manifest. Several years. If you developing diabetes, probably 30 years ago, your endothelial lining started to be dysfunctional. The process continues. All this time, you completely have no symptoms. You are completely asymptomatic. So you walk around and say you are healthy. The process goes on. This is what the father of medicine is saying. He said it 500 years ago. It is true today. It will be true in as long as we humans live and we develop diseases. But we're not paying attention. So 30 years ago, that one cell lining started being dysfunctional. It goes on, until, like he said, there comes a time. During this time, we, the healthcare professionals, are not looking. It's unfortunate. We're not paying attention. You may or may not know. And it's not just that we're not paying attention. We're misleading you when you come to us and say, well, I check your blood pressure, I check your heart rate, I have checked your glucose, I have done the basic thing, I have physically examined you. There is nothing for me to do further. You are okay, I'll see you back next year. Endothelial dysfunction continues year after year, year after year, visits after visits. Then one day, you develop a symptom. Oops, you have high blood pressure. 25 years before, the endothelial lining your blood vessels were disruptive. They continue in the process. And we tell you that you are healthy. Then we tell you that you are young. You don't worry about that. Then the disease develops. How do you stay healthy? As if that is not enough. Look around you. It is true, another fact, that today we as humans are living in an era where we are bombarded by tons of toxin than any other era of humans. That is true. We are eventually killed by what we eat, by what we drink, by what we breathe, and by what we put on our body. That is robbing us of our health. and eventually killing us. Right? It is true that every 10 years, we all double our risk of dying. Every one of us. Every 10 years, our risk of dying will double. This is why, after a certain number of years, no one of us will be living. That is true. These things may accelerate that rate, even though we have the chance and we also have the ability to prolong that. That is what health may translate into if you decide to pick the definition of being in a disease-free state. That is what you will essentially be saying. Let me impact that rate in some way. Now, during this process, what is the quality of health that you have? We worry and do much to prolong life at the expense of quality. They pulled quite a number of people in a room, and let me put it to us. If God was to descend here this evening and said, I'm going to give you two choices. Yes, each and every one should pick one. I'm going to give you 15 years where you're going to live a perfectly healthy life. You can do everything you can. You can walk around. You can play wherever you have. You'll be the happiest. You could have everything. At the midnight of the 15 years, I'll take you quietly away in your sleep. And then another group, I'll give you 50 years. Out of these 50 years, some of them, you're going to be in a wheelchair. You're going to have a trach in your neck. There's going to be a tube in every orifice of the body. You would have to be fed in bed. They have to bring you. Which one do you think?
15.
Right? Yes. So the quality matters. The quality of health matters. And when you give somebody a good quality of life, quantity of life will follow. When you keep somebody healthy, that is when you give good quality of life, then quantity will follow. Look at your doctor today. When you go to see him, he has 13 to 16 minutes to see you. A doctor's visit today, exceeding 16 minutes, is extremely very good. He has 13 to 16 minutes to complete a visit. What do you do at that visit? Ask questions, examine you, put the data together, think about specific lab tests to order, formulate a medical decision, and formulate a treatment. 16 minutes. How do you remain healthy? We are the gatekeepers to keep you healthy. How do you remain healthy? In 16 minutes. And then your endothelium is decaying. Then we send you home. Then it's as if we're telling you that the disease is not manifested. Go wait another year and come. Then you come and the process continues. How do you remain healthy? It's a fact that if we were to subject each and every one of us to some blood work looking for toxins in us, we're going to find a lot in each and every one of us. In 2019, 8 million people died prematurely from environmental pollens globally. The number is rising. Toxic environment. How do you remain healthy? How do you remain healthy? Very difficult. Everything you look around seems to be fighting against your health. Eight-hour ride in a plane is equivalent of smoking cigarette for about 3 months. Electromagnetic waves everywhere. Cell phones. Toxins. Microwaves, toxins, disrupting endothelial lining. We've traded comfort of living to shorten our health. How do you stay healthy? How do you stay healthy? Yes, if you were to ask anybody, if you were to look around, if you were to talk to any number of sources, and you ask, how do I stay healthy? We will recite everything. Diet or eat. Good food, good fat, good protein, cut of carbohydrate, cut sugar, we recite them. Oh, physical activity. Go walking, go running, go to the gym. We recite them. Very overwhelming. We give you 20, 30 different things. You come to me, I tell you something. You go to the next physician, you are told a different thing. You stay with your TV, you hear something else. You go in, you learn something else. Low-fat diet, high-fat diet, low calories, high calories, everywhere. Confused, just overwhelming. How do you stay healthy? It's almost as if it's a losing battle. How do you stay healthy? Whilst all of this is looming, You look at the things that are killing us, and it's very alarming. Cardiovascular diseases still remain the number one killer in the United States. 1 out of every 4 deaths, 1 out of every 4 deaths is associated with a cardiovascular event, with a heart event. Every year, 610,000 people will die from a heart-related problem. Every 42 seconds, I think I've been here about, 20 minutes? About 30 people have had a heart attack. Every 42 seconds. Every 1 minute, somebody will die from a heart attack. How do you stay healthy? These things do not happen suddenly. Several thousands of deaths come suddenly. And we say, oh, there was nothing wrong with him. The endothelial lining have started. Unfortunately, in some people, the very first sign of a disease will be death, depending on what we're talking about. But how do we stay healthy? Death from, let's put this into context, cardiovascular death. If you want to put it into context, it is just like taking about 4 large jumbo jets. Sometimes these jumbo jets will carry about 250 to 300 people. You take 4 of them, crash it, and kill everybody every hour of the day and every day of the week and every week of the month. That is how much we die from cardiovascular disease. How do you stay healthy? These things did not happen suddenly. It just didn't come out of the blue. The process was going on. So many times, I'll see patients who comes to me and will say, well, doctor, I have nothing bothers me except a small back pain here. Otherwise, there's nothing bothering me. Now, that back pain is showing up now, but it started about 20, 30 years ago with a dysfunction in the endothelium. And when that was dysfunctional, other systems are also in the process of getting there. The only thing is that the derangement in the nervous system was the first to show up. That's why you have only back pain, but that is not the only thing that is cooking. In some others, it will be death. How do we stay healthy? Not about rattling all the things that we say, go do that, go eat good food, go sleep well. All of that is good. All of that is good. Yeah, you eat very carefully, you spend time to sleep, you restore the body, you restore the functions of the brain while you're sleeping, you decrease your risk of getting central nervous system diseases, behavioral problems. Yeah, all of that is good. but the forces hitting us, pushing us towards disease state seems to be stronger. And for a moment, it seems as if we have no ammunition towards this. We just have to stay with the flow till the disease state comes. It is for this reason that I want to spend just some few minutes to just stress some few things that could be very helpful in minimizing some of these problems. Just some few minutes and some few things to minimize these things. And it's not going to be any exoteric things. In one of them, and a very important one, as clearly as we have stated, cardiovascular disease remains one of the leading causes of death in this country. It's alarming. It starts with dysfunction of the endothelial system. In the 90s, 3 American scientists developed or discovered or worked to show that there is a specific molecule, nitric oxide, which is the signaling molecule that regulates circulatory process in this single endothelial lining. In other words, many of the abnormalities that leads to the problems in the central, thank you so much, that leads to the problems that we discuss will come through deficiency in nitric oxide. When there is nitric oxide, adequate nitric oxide in the body, it softens the arterial wall. It decreases blood pressure. It decreases heart rate. It makes the organs work very well. It ensures that there is good circulation in just about every organ, every tissue. Nitric oxide. In fact, so important and so significant was its role that these 3 scientists were awarded Nobel Peace Prize. I'm very certain that when we sample our nitric oxide right now, maybe 75% to 85% of us will be deficient in nitric oxide. Something bad is happening. We are not healthy. We don't have a disease or a diagnosis yet. But nitric oxide now comes in to objectively support what the father of medicine said about 500 years before Christ. Now we have a way to show that all the while that we sit and we say we're healthy, something is wrong. And that we can objectively show by showing deficiency in the nitric oxide. Now, everything that is preventative, unfortunately, is not emphasized. Insurance company won't pay for it. Go get it on your own. doctors may not have an incentive to work with this. It is so true that on a molecular level, it is the centerpiece of all the disease process. Now, we have lumped all these diseases and we call them metabolic syndromes. And there are a lot of things that comes into it. Obesity, high blood pressure, diabetes, you have hyperlipidemia, that is lipid problems, cholesterol we put all of this together. They are all accelerators of cardiovascular death. When we restore nitric oxide, a vast majority of these things would be reversed. How it is not emphasized, how it is not stressed, to that point beats my mind. But then again, it's not surprising. It is so valuable that I think anyone after 45 years or so, if you're not checking your nitric oxide once in a while and restoring it, you may be doing yourself a very big disservice. It will take quite some time before it rolls into conventional medicine. Somebody has to pay for it. And it's preventative. It's not treating any disease. If you are 45 and above, if you take nothing from this talk today, just say all what we said was just rubbish, please take with you that nitric oxide significantly decrease that risk that you would have associated with a cardiovascular event. It is a fact. It is true. Do yourself some goodness, and if nothing at all, check your nitric oxide once in a month. If you won't do it at all, at least once in a month. Thankfully, there are products on the market today that will help your body to create its own nitric oxide. You know, it is created, God gave it to us to maintain the organs. When we age, we lose its concentration. At some time, you will have almost nothing. At a molecular level and at a cellular level, the organs are deteriorating. They are not up to the point to develop symptoms yet. So we say you are healthy, you are not. On the molecular level, something is happening. Nitric oxide can be very helpful in minimizing that risk. All the deaths that we spoke about associated with cardiovascular event all comes through the cardiometabolic syndrome. And nitric oxide will do a lot. softens the artery, decreases the pressure, make it more malleable, decreases the resistance with which the heart has to pump its blood, make the organs more malleable. It's just a wonder molecule. How and why it is not strongly incorporated in preventative care still beats my mind. Preventative care. That is what the father of medicine was drawing our attention to. Diseases just don't spring up out of the blue. They start in a process, and you can prevent that disease from happening. Another important thing that has been clearly shown in scientific literature is vitamin D. Vitamin D3. Again, when we check our levels right now, more than 65% of us in the room will have a low vitamin D level. In fact, without going into technical biochemical processes and all of that, vitamin D3 long has been associated, optimal levels of vitamin D3 has long been associated with wellness. You go to the ICU nurses and doctors, those who are critically ill all have a low vitamin D level. During the COVID, it was very difficult to find someone who had COVID, who got admitted into the ICU, who became critically ill if they had optimal vitamin D level. There was nothing like that. Those who were very sick, who had severe morbidity and sometimes even mortality, had a very low vitamin D level. In fact, it's true that certain surgeons will not even operate without checking your vitamin D3 level, because it's associated with wellness. It is amazing how well you feel and how much disease you push away with an optimal level of vitamin D3. It costs about $30 to get about 90 days supply. Vitamin D3. It is critical in the disease process of the cardiometabolic syndrome. That's how you stay healthy. That's how you push some of this away. If you take nothing at all, 45 and above, nitric oxide, adequate vitamin D3, you will be doing very well. Now, vitamin D3 have the ability to bring calcium out of the bones. So it brings calcium ions out of the bone and make them float in blood. And by so doing, they can thicken the walls of the vessels. We have an answer for that. Vitamin K2. Vitamin K2 will push the calcium ions back into the bones. So when you set out to look for vitamin D replacement, there is usually a combined pill, D3 and K2. Please look for that. Use it. It's life-saving. It decreases risks of cardiovascular disease. You can do something about staying healthy. Another thing, magnesium. These are facts, and a vast majority of us lack these things, and that is driving these numbers, and these are preventable. When you do this, you replenish your nitric oxide, you supplement your vitamin D3 with K2, you get your magnesium, you are significantly reducing your risk of a cardiovascular event. Significantly. Stay healthy that way. Yes?
Are we taking both the D3 and K2, or you are supplementing one for the other?
Two together. It's a combined, yeah, it's a combined pill. D3 and K2. We walk around, we will see some of the numbers. Mental illness, depression. Yes, there are factors that are driving it. Emerging literature is showing that significant number of women on antidepressants have a very low vitamin B12 level. B12, and they begin to feel well. Stay healthy with this. If you do this, it's very important to do this, to stay healthy and not pull into the disease state. Now I'll show you one more reason why it is important to institute these preventative measures. If you don't, you will end up with a disease much faster than you should. That's a fact. And if you do, you end up in our hands. And we intend to do good work. We try. But let me show you also sometimes what happened. The other slide, please. Facts. Why it is important to stay in a preventative mode. 70% of Americans are on one prescription drug. 70%. 7 out of 10 drugs can have problems. It's clear that we are quick, we physicians are quick putting patients on drug. You come to me with a problem, I have a drug for you. Then you go, you come, this drug is making my spine head. Then I'll treat you with another drug. Then you come, that treatment gave me a headache. Then I'll drugs that the combined effect has not been significantly studied together. If you prevent illness, you are likely to minimize your risk for something like that. 50% are on at least 2 prescribed drugs. The problem would combine. These are facts. This is not a discussion. These are facts. It is as true as the statement that this date and time we are all in this room. 1 in 4 women aged 50 to 64 will be on an antidepressant. Maybe what they need may be vitamin B12. Check your vitamin B12 level. Let it be optimal. Get your vitamin D3. Do these things. Magnesium is involved in over 600 biochemical reactions. When it's missing, things would go wrong. When we check here, %70 of us will have a low magnesium level. And even the blood magnesium level will oftentimes not adequately correlate with what is in the cell. So you need more. Yes.
So the supplement for magnesium, is there any diet like fruit or something that can also generate the same result?
Yes, but then you will probably have to eat so much of it, right? Maybe all the plantain in Greensboro. We got to go around, collect all of them, and bring them to you. We got to maybe get some also from Winston-Salem. Just to add it up, right? Now, 88% of the people over 64 take at least 1 prescribed medicine. That's a lot. 64. Physiology is altered. These medications are foreign substances to the body. Yes, we use them with the intention to fix something, but there are adverse effects. Very soon you will see that errors that we do and the hospital do and the healthcare workers do will be the 3rd leading cause of death in the country. If you took to preventative care and do these things and get yourself out of our hands, you will be doing yourself a good service. Every day, 290 people are killed by FDA-approved prescription drugs. Every day. That's not street drugs. 290 are killed by FDA-approved prescription drugs. Stay healthy. Do preventative care. Take yourself away from us. Yes, we do great work. We care. We want to take care of you. All these things, I'm not saying them. Yes. Okay. All these things, I'm not saying them to just create stir, but to just bring up the point that you can do better with preventative care. Right. Next slide. And then in 5 minutes we will end questions. If no questions, we will step out and then. Now, 12,000 deaths per year due to unnecessary surgeries. It is not that the surgery is necessary and these are complications of it. No. These are unnecessary surgeries. 12,000 of them every year. 7,000 deaths per year due to medication errors in hospitals. That's a lot. This is why you have to try to stay healthy with preventative care. 20,000 deaths per year due to errors in the hospital. $80,000 deaths per year due to infection in the hospital. That's a lot. Stay away from us. $106,000 deaths per year due to adverse effects of drugs. That is different from errors in drugs. These are drugs intended to treat your condition but have adverse effect, untoward effect. Then vaccines. Now, this is just to say that there is a strong place in practicing preventative care. Thank you. I'm sorry I took a little bit of a time, but I'll stop here and thank you for your attention. Yes, if. Yes. 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 So you're right. You could see several compounds of magnesium, magnesium oxide, magnesium chloride, citrate. Now, the very best one that I use, and I tell my patients to use, is magnesium threonate. Why? Because it's got a good, it bypasses the GI effect, the effect, of the, diarrhea. Yeah, it makes it uncomfortable. And some of it can cross the blood-brain barrier. So you sleep well, your mental state is significantly improved. It clearly decreases your blood pressure. Your microcirculatory function gets much better. Magnesium threonate. Yes. Yeah. Mm-hmm. Yeah. Threonate? Yes, it's Threon.
But we are searching it and it have an L in the middle.
If you have a question,
Yes.
you raise your hand, and then when you are called, you rise up and ask your question. Let's do it professionally.
Yeah.
Amen.
You got. Yes. Okay. Any other question? Yes, please. The dosage? Yes. Usually, you will be safe with 400 to 600 milligrams. Now, usually 400 milligrams is good. Now, magnesium have to go into the cells, and sometimes you need a higher dose to allow a concentration gradient to cross those memories. So 400 to 600 milligrams is okay. Now, in that range, once a day, you're not likely to have magnesium toxicity. Yeah. All right. Ye- yes. It's a gas, but it could not be produced in a gas, right? So we place the formulary there. Your body would make nitric oxide, but you would have to supply the ingredients for it to be made. It's a form of a gas. Yeah. Yeah, they are supplements. Yeah, they are supplements. Yeah. Mhm. Yes, please. Mhm. Well, vitamin D, vitamin D, adequate magnesium are the most profound way of changing your endothelium in the very long run. Now, magnesium will work intracellularly to smoothing and ease the capacitance of the vessels in all the tissues that you find them. Okay. Yeah. Yeah. Mhm. Yeah.
So I just have a follow-up regarding the vitamin D.
Yes.
So most people, when they get their vitamin D levels checked, it's significantly low.
Yes.
So the over-the-counter dosing
Yes.
typically is not sufficient enough to keep
Yes.
them up. Would you recommend that they get a prescription dose and then after that continue, or just take the over-the-counter?
I have found out that the prescription dose doesn't even work very well. The weekly prescription dose. What I tell my patients to do, and I have thousands of them, and I have reproduced the result over and over and over again. 10,000 international units of vitamin D3 plus 100 micrograms of vitamin K2 taken every day for 90 days. And we don't guarantee a lot of things in medicine, but I'm almost there that whenever time I check, I'm in the zone that and you bring a good point. Now, the vitamin D, you may have a normal vitamin D level. Many a times it's lower or just the lower end of norm, and yet it's not optimal. The optimal values should be around the range of 60. In fact, around 60 is very hard to find somebody who would be critically ill. It strengthens the immune system, stabilizes the different organs, just such a strong stabilizer of cell membrane. Yes. No more question? Thank you. Yes, there's one.
We're talking about vitamin D3. I know the D2 is 50,000. D3 comes in different dosage. So how much dosage are you recommend for us to take daily?
Yes. So usually 4,000 to 5,000 international units. Usually. Now, this should be matched by your vitamin D level, right? If it's so low, I will start from 10,000 international units with 100 micrograms of vitamin K2 over a 90-day period, and I'll check the level again. If I'm above 60, I'll hold doses for about a week or two and restart, and then check again in 30 days. Yeah. All right. Yes, please. Yeah.
So sunlight
Yes.
gives vitamin D.
Yes.
And yet we're told to stay out of the sun,
Yes.
correct?
Yes.
So would you recommend for it or against it in addition to sunscreen?
Yeah. Yeah. Are there people who are deficient in vitamin D in Ghana? Yeah. Yes. Yeah. Yes. Sunshine. Yeah. Definitely. A natural way of getting vitamin D3. And I think we're all deficient because we don't spend a lot of time. Yeah. And we have a lot more scientific findings associated with that. Now, we tend to have upper respiratory symptoms and all of that during the winter months, right? When we don't spend a lot of time. And those things are correlated to low vitamin D level, right? So yes, staying in the sun is helpful. I doubt if you have low levels, staying in the sun alone will bring it up. You will need some supplementation, yes. Yes.
Those numbers on the daily intake of the magnesium and K2 that you are just talking about.
Mhm.
Is it on the slide? We have
Yes,
you know,
yes. In fact, there is a handout. There I put these things together. The nitric oxide, the vitamin D3, the magnesium, I think, Tyrone? Yes, there are some handouts that we can get it out when we get back there. Okay, yes. Mhm. Yes. All right. Any other question? All right. Yes, please. Mhm.
I heard you a couple of times saying stay healthy, stay healthy.
Yes.
So other than all this supplement, what else can we do?
Yes.
Like you're very skinny. What do you do?
Yeah.
The supplements.
I'm skinny and I have no hair, right? That is working with insurance companies. Just kidding. Just kidding, yeah. I think, yeah. Actually, what else can we do? Yeah. They are the things that they tell us every day. They help, right? Eating sensibly, right? With paying attention to what we eat, how much we eat, and when we eat them, right? Physical activity. Engaging in some physical activity, the same recital, running, walking, swimming. I do a lot of walking. Resting, a good night's sleep. When you sleep, you restore the body. That is when the body is clearing the waste in the brain. It's moving all the amyloid plaques whilst you sleep in a good night's sleep, practicing good and sleeping habits, sleeping consistently at a consistent bedtime, waking up at a consistent time, using the bed for only sleep, trying to get 7 to 8 hours of sleep. If you are on adequate magnesium levels, yes, you will get it. Staying away from other risk factors and all of that, yeah. Mm-hmm. Any other questions? Yes, please. Mm-hmm.
Especially with this community where everybody drives.
Where everybody drives? Yes, yes, yes.
You mentioned that you do some
Yes.
exercise every day.
Yes.
So do you recommend, I'm sure most of us don't go to the gym. So do you recommend, we do walk? Because even when we are walking, we say the sun is so scorching.
Yeah.
Do you recommend to walk like 3 days in a week, like 30 minutes, an hour?
Well, that I don't do that, but that is the recommendation. I walk over the weekends, all right? And then during the weekday, if I could, maybe 10, 15 minutes, that's all. Yeah, but the kind of physical exertion that translates into reasonable health does not necessarily imply going to lift all the metals in the, no. Yeah. Brisk walking for 20 minutes every other day is just fine. That's what usually is recommended. Yeah. Yes, please. Mhm.
So, on the note of health, and I'm going to speak on behalf of some of the women here
Yeah.
that I know. What is your opinion regarding detox? Like people are blending things and drinking,
Yeah.
saying that it is removing parasites and toxins from their bodies. What are your thoughts and opinions on that?
Yeah. There are a lot of things, right? There are a lot of agents that are being used for so many reasons. You look on the internet and your head will spin. And there are just countless number of things that are used. And the problem is we don't know what these things are. And you cannot comment on things that you don't know about. It's very difficult for the physician to know exactly what you take. There are a number of times that I have had people bring in things that they are taking, then I have to go look. There are countless number of them. And it just depends on what the person is taking. Yes, we are loaded with toxins. We are loaded with, we have toxins all over. Parasites, heavy metal, virus. We are loaded with toxins. If something is not dangerous and it detoxifies something, great. But do you know what you're actually ingesting? If you know it, you feel safe with it, great. But I think we physicians don't know all of it because they are just too many and overwhelming, and the source, we work with things that has been studied. This is why there have to be those disclaimers on things that has not been studied, and that we cannot make claims for those things as treatment of conditions. When you don't know it, you don't know it. It's difficult to comment intelligently on something you don't know. Yeah. All right. Thank you. Yes, please.
Some of the packages are very, how should I say, deceiving because they have
Yes.
so little.
Yes.
But there's a thing that they say bioengineered. A lot of those ingredients, they actually cause cancer. So I know you didn't bring that up.
Yes.
You know, when you was up there.
Yes.
That was just something since we're.
That's right. That's right. Yes. Thank you for bringing that up. Yes. Thank you. Yeah. Cancer would have been a whole different talk, right? And it's true. It's very closely related to, closely behind cardiovascular disease as a number one killer. In fact, in the next 15 years, by 2040, 1 out of every 2 persons will likely develop a cancer. Nearly 30 years ago, when I started my residency, it was very difficult to see cancer in this frequency. you hear of one cancer case, then you don't hear of anything until after 6 months, 9 months. Today, so thank you. Yeah, it's very close next to cardiovascular disease as the number 2 killer in the United States. Yeah, thank you. Yeah.
Thank you. I believe that will be the last question. It's past 8:35. It's time to go to the surgery room. We'll check out. We are going to consult.
Oh, okay.
Yeah. The consultation room or the surgery room. Everybody's going to get checked out.
We will take offering before we go.
We'll take some- okay. I almost dodged the protocol. We have to take offering before we go for the consultation room. But before we go, please, have we learned a lot today? Are we grateful? Let's put it together for Doctor. That is well. Thank you very much, Doctor. Thank you very much. We are very grateful.